I'm 89 years old. I worked 45 years in emergency rooms, and I saw what happens when leg strength disappears. So what do you do when your knees can't handle squats anymore? After 75, deep squats can irritate knees, so here are 5 rehab-style exercises that build strong legs with less joint stress. Number 1 is what I personally do at 89. Let's start with number 5. In the 5th place, the seated marching hold offers a gentle way to wake up your hip flexors and start building leg strength without standing. Sit tall near the front edge of a sturdy chair, feet flat on the floor. Lift one knee up toward hip height and hold for a count of 5, then lower and switch sides. Aim for 10 lifts per leg, 2 short sessions a day. If lifting high is uncomfortable, just raise the knee as far as feels safe. Over time, try holding longer or add a light ankle weight for a bit more challenge. Research in adults aged 78 to 86 shows this simple move can improve muscle endurance by 14% and lower fall risk by 10% in 12 weeks. Always go at your own pace and check with your doctor before starting any new exercise, especially if you have heart or joint concerns. Number 4, the wall-supported heel. Raise helps build calf strength and ankle stability, 2 things that make walking and standing much easier as we age. To start, stand facing a sturdy wall. Place both hands flat on the wall at about chest height for balance. Keep your feet shoulder width apart with a gentle bend in your knees. Slowly lift your heels as high as you can, rising onto your toes. Hold that position for a count of 3, then lower your heels back down over another 3 seconds. Take your time. Slow lowering works the muscles even more. Aim for 2 or 3 sets of 12 to 15 repetitions, 3 times a week. If standing is too difficult, begin with a seated heel raise. Sit on a firm chair, press your toes into the floor, and lift your heels up and down. When you feel steady, try a single leg version for more challenge. Research in adults around age 76 shows this simple move can increase calf strength by about 12% and improve balance reach by roughly 14% after 2 to 3 months. Keep a hand on the wall at all times and stop if you feel pain or sudden discomfort. Always check with your doctor before starting new exercises, especially if you have lower leg or foot problems. Number 3, sit to stand with mid-pause is the exercise that most closely matches a daily challenge, getting up from a chair safely and with control. Many older adults find that standing up gets harder each year. The problem is, when we use momentum to pop up quickly, we can mask weak quadriceps and miss the chance to truly build strength. Adding a pause halfway up changes everything. Here's how it works. Sit near the front edge of a sturdy chair, feet flat and shoulder width apart. Cross your arms or place your hands on your thighs. Lean forward slightly, press through your heels, and begin to stand. When you reach halfway, about the point your hips are just off the seat, pause and hold for 2 to 3 seconds. Then continue to a full stand. On the way back down, lower yourself slowly over 3 seconds. This slow descent is just as important as the rise. Aim for 2 sets of 8 repetitions every other day. If a full stand is too difficult, start with a higher chair or just rise partway and pause. As you get stronger, lengthen the pause or use a lower chair to build strength. Studies show that adding this mid-rise pause can boost your repetition capacity by about 20% compared to the usual quick up and down. The Centers for Disease Control and Prevention STEADY program uses the Sight to Stand as a fall risk screening tool, and research links improved chair rise performance to greater independence and lower fall risk. Always use a stable chair, keep a hand on the armrest if you feel unsteady, and stop if you feel pain or dizziness. Before starting, check with your doctor, especially if you have had recent surgery, heart trouble, or trouble with blood pressure. Small, steady gains in this movement can make standing and walking safer every day. Number 2, the side-lying leg lift with hold is my go-to for building side-to-side stability without stressing the back or knees. This movement targets the gluteus medius, a muscle on the outside of your hip that keeps you steady when you walk and helps prevent sideways falls. Many older adults lose strength in this area, which can lead to shuffling, wobbling, or even tripping over small obstacles. Improving this muscle's power can make a real difference in daily confidence. Lie on your non-dominant side on a firm surface like a mat or a bed. Stack your hips one on top of the other and bend your bottom knee slightly for support. Keep your top leg straight, toes pointing forward, and slowly lift it about 12 to 18 inches from the floor. Hold it in the air for a count of 5, then lower it down over 2 seconds. Avoid rolling your hips backward. Keep your body in a straight line. Aim for 10 slow lifts on each side, 4 times per week. If lying on your side is uncomfortable, place a pillow under your hip or do the movement seated, pushing your knees out against a resistance band. As you get stronger, you can add a light resistance band around your knees for a greater challenge. This exercise is gentle on the knees and spine, making it a safer option than standing side steps or deep squats. In a pilot study of adults over 80, practicing side-lying leg lifts led to a 19% improvement in lateral sway stability, meaning participants were less likely to lose balance when shifting side to side. Many also reported feeling more secure when stepping sideways or turning around corners. That is a meaningful change for staying independent. Remember, go at your own pace. If you feel pain in your back or hip, stop and adjust your position. Never force the leg higher than is comfortable. Consistency is key. Doing this simple move most days of the week can help your hips support you during walking, standing, and even getting out of bed. As always, check with your doctor or physical therapist before starting. If you have a history of spinal fractures, severe osteoporosis, or other medical concerns, building side-to-side strength now sets the stage for even better balance in everyday life. And finally, in first place, chair-supported single-leg balance taps bring together everything we've built so far, strength, balance, and confidence, into one practical movement. This exercise is my top choice because it is the closest thing to real-life balance training, but with a safety net. As we age, standing on one leg becomes harder, yet it is essential for daily tasks like stepping over a curb, getting dressed, or catching yourself if you stumble. Practicing single-leg balance taps can help retrain your body to react quickly and stay steady, even if your legs feel weak or your knees are sensitive. Here's how to do it safely. Stand next to a sturdy chair with your fingertips resting lightly on the backrest. Shift your weight onto your left foot. Lift your right foot just 1 inch or 2 off the floor. Slowly tap your right foot forward, bring it back to center, then tap to the side, back to center, and finally tap behind you. Move slowly and with control. There is no need to rush. After you finish all 3 directions, that is 1 cycle. Switch legs after 5 cycles. Aim for 2 sets on each leg, 5 days per week. If you feel wobbly, keep your whole hand on the chair. As you gain confidence, try using just your fingertips, or eventually balance for a second without touching the chair at all. For those who want more challenge, try the taps barefoot, or close your eyes for a brief moment, but only if you feel steady and safe. If standing is too difficult, start by sitting tall in a chair and tapping your foot in the same pattern. Then progress to standing when you feel ready. Always wear supportive shoes and make sure the chair does not slide. Never use a rolling or unstable chair. If you have severe foot numbness, recent leg surgery, or uncontrolled dizziness, get your doctor's clearance before starting. Research in adults between 78 and 86 years old shows that adding chair-supported single-leg taps to a weekly routine can improve Berg balance scores by about 4 points, a change linked to a 30% drop in fall risk over 12 weeks. That is a meaningful difference. Gaining even a few extra seconds of balance can make the difference between a close call and a dangerous fall. I use this movement myself, and it has helped me feel more confident walking in crowded places or stepping over obstacles at home. Remember, go at your own pace. If you feel pain, numbness, or sudden dizziness, stop immediately. Consistency is what counts. Practicing a few minutes most days can rebuild your balance, one step at a time. The exercises shown are for educational purposes only. Please consult your healthcare provider before beginning any new movement program, especially if you have medical conditions or concerns. Across all 5 exercises, one truth stands out. Rebuilding leg strength after age 75 is about safe, steady practice, not risk or pain. Simple movements done with care bring confidence and stability back into daily life. It's never too late to make your legs work for you again. Stay steady, stay motivated.